Hello and good evening and welcome to another Aucademy Live. And tonight we are joined again by Dr. Mel Houser to again discuss all the things and to talk about general sort of communication and management with your doctor or physicians. And we're also joined as well alongside with Sai, another Aucademy educator and advocate. Could we begin with people doing a physical description, please? Mel, do you want to start?
Absolutely. Hi, I'm Mel Houser. I use she, they pronouns, physical description. I'm a white-skinned, feminine presenting person with short, dark brown hair, and I'm wearing a teal colored shirt.
Thank you. Sai? Sai says, Northern Naughty says, I definitely am. So, by the way, just a pigeon with a glorious plumage. Indeed it is. Standing in the middle of London Bridge. I am Victoria. My pronouns are they, them. I'm white person with long grey hair, wearing a purple hoodie and sat on a purple sofa. That's about it. So we'll begin with another one of our usual questions, which is, as I'm scrolling up because my brain has gone, who are you? You've just said your name. And what are your dedicated interests or specializations? Sometimes referred to as special interests.
So my monotropic focus is what we're going to talk about today. My monotropic focus is this big picture of the multi-organ system health challenges that many, if not most, autistic adults experience.
That's great, thank you. And again, when did you discover that you were autistic?
So like many late identified adults, I was diagnosed in the setting of autistic burnout. In spring of 2021, it had been a year and a half into COVID, and I was like, I had a job that was a really poor fit for my access needs and like ran me into the ground, and I was homeschooling and then 3-year-old, and like chaos capacity far exceeded by the demands of my life, and that's how I got my diagnosis.
That sounds about right. I think it was burnout that I discovered, and through my own daughter as well. Are we going to begin with, you have a presentation? Do you want to begin with that tonight?
Yeah, I think that'd be great. One thing I want to do is just like a content warning about the health topics. So we're going to be talking about physical health conditions that can be upsetting and distressing for people. And so that, that might include pain, that might include vomiting, that might include, a whole range of whole body discomforts and sufferings. And then before I even get into that, one more content warning is that I will briefly mention suicide because I want to be talking about the why we're talking about this topic and why this is so important. So, and I'm going to begin with that, and then we'll be done with that. So present and share screen. No, that's not what I want. Oh yeah, I'm supposed to ask for help for Ben and Sai. There we go. Cool. Okay. So just by way of context is that I run a nonprofit organization called All Brains Belong in the United States. And it is an organization dedicated to improving the lives of neurodivergent people across the lifespan. And we do that through neurodiversity affirming medical care and a range of community programs. And when we launched, I knew that there were medical conditions that were more common for neurodivergent people, but I really didn't get it until I was doing this work. It became so clear within just a few months that there was a pattern of physical health conditions that all ran together. And now I can tell you that in my practice, my tiny little startup nonprofit practice, 70% of our practice has what I'm about to share with you today. And we're going to do a bit of review because when I was here on Aucademy in October, we kind of deep dove into what we're going to call all the things, because there is no one name to describe all the things that many of us have, myself included. So we're going to get everybody on the same page with a review of all the things. Then we'll go into some general principles of management for educational purposes only. And by request from last time, some tips for talking with your own healthcare provider about all the things, because we should assume that most don't know about this. So here we go. Shocking statistics. Average life expectancy for an autistic person, 36 to 54 years. When I learned that, I was 37 and I had just received my autism diagnosis. Like, what? This is a public health nightmare. And the literature shows that the leading causes are premature cardiovascular disease and suicide. And yeah, you can learn this fact and say, oh, that's terrible, but like, why? Why the cardiovascular disease? No, I've not heard anybody talk about that. And so when we go through the multi-organ system health problems, I think this directly connects to the premature cardiovascular disease and to suicide. So there's all this literature. These slides are like intentionally busy, like there's all this literature linking autism to like a whole bunch of different health problems. Hypermobility, Ehlers-Danlos, obstructive sleep apnea, autonomic dysfunction, like all this fibromyalgia, all these little pieces. But when you zoom way out, it's a pattern. It's a pattern of all one thing is what we're seeing here. And unfortunately, not only are medical providers generally not trained in adequate information about autism in general, the physical health, the different physiology that we have, that's just entirely missing. This slide I use whenever possible because it's just so ridiculous. Zerbo et al. In 2015, less than 10% of primary care physicians would expect autism if a patient volunteers information, shows interest in people, discusses emotions, and can see the whole picture. Well, yeah, I'm autistic, and I'm going to share with you the whole picture of what I'm seeing. And I think that when people are experiencing, sure, if somebody comes in and says, I'm autistic, maybe a healthcare provider might match their symptoms to something they know is more common for autistic people, but that's not how most people come in. You come in with your symptoms. And so if we flip the script, it's not, I'm autistic, and the provider has to match the symptoms to knowing that the person's autistic, but it's the bottom up. If somebody comes in with something in the allergy/immunology bucket, including long COVID, allergic disease, sinus disease, asthma, mast cell activation, unexplained severe allergies, something in the sleep bucket, like sleep apnea or circadian rhythm disorders, something in the gastrointestinal bucket, whether that be reflux or irritable bowel syndrome or esophageal spasm, like chronic constipation, so many different GI symptoms, something in the neurologic bucket, something in the connective tissue bucket, whether that be musculoskeletal, joints, bones, ligaments, muscles, or blood vessels or skin. This is all stuff made out of connective tissue. Something in the nutrient absorption bucket, something in the face, jaw, oral bucket, tongue ties, periodontal disease, temporomandibular joint, TMJ dysfunction. This is one pattern. When somebody comes in with most of these 7 buckets, there's a high likelihood that they are neurodivergent in some way or another. So when you zoom out, these are patterns that interrelate. And unfortunately, in 2023, we have a healthcare system that is so fragmented that that looks at problems through this really narrow lens of body parts. But these all interact, which is, I think, a limitation to really providing adequate medical care if you're treating these things like so separate. And we'll get more into that when we get into management. Oh, is that now? Great. So, so, I need to give a disclaimer. We were talking, the Aucademy crew and I were talking about this where we started, and it's just like, the world rules of like what I'm allowed to say in public to people who are not my patient. So today is for educational purposes only. I'm happy to answer questions, general questions. I'm not allowed to give you medical advice. So specific individual questions, I would encourage you to direct to your healthcare provider. But because we know that many healthcare providers don't know about this, we're also going to talk about how might you have a conversation, about that. So I'm gonna summarize this in 3 all the things management pearls. So given that, and again, we don't like have a name for this whole thing, so we're gonna call it all the things for today. So the idea would be that you seek strategies for your most salient, distressing, quality of life limiting part of your all the things that don't make the other parts of all the things worse. Give you an example of this. So I have pretty significant dysautonomia and POTS in particular. So compression garments are one of the standard common things that go into this management. And yeah, like they help a lot. However, when I have too much compression on, I also cut off my blood flow to my feet. You got to find strategies for your symptoms that don't make your other parts worse. Or, for example, a lot of people with chronic pain end up on a muscle relaxant. Well, if you also have floppy connective tissue from your unrecognized hypermobile Ehlers-Danlos, and you had sleep apnea related to this because your airway connective tissue is closing on itself while you're sleeping, those muscle relaxants might actually be making you worse. Internal conflicting access needs all day long is what goes into the management of all the things. And one of my patients, I really like this quote. It's like when I was explaining this to them, they said, "Oh, it's kind of like a ball and knot, like a knotted ball of yarn. And if you pull the wrong string, you make the knot tighter. You got to find the right string to pull." And yeah, that's exactly how it is. I gave the examples of compression, muscle relaxants, but also thinking about medications. There are medications that say, for example, many people with POTS get put on a beta blocker, that class of medicines acting on the cardiovascular system. But beta blockers are a common class of medicines that trigger mast cell activation syndrome, which is another part of all the things. Or some people get put on atypical antipsychotics that are blocking dopamine, despite most of us having dopamine-bound brains. So it's all this. Pearl number 2. While I can't give you medical advice, I can direct you to better search terms. So this is an example, and I think there's so many examples, right, of the limitations of the medical system. All too often, patients have the experience of a medical provider discounting the patient's own expertise in their own body. And this is an example where the healthcare system doesn't have a lot of the answers that people need. And if in 2023, you can go on to social media. This is a major crowdsourcing success. You just got to know what you're looking for. And you can't search, oh, I have a 6-year-old who's joining us. Yes? Honey, baby, I'm doing a presentation. I definitely cannot search for something. Can I do search for something after my presentation? Okay. I can help you after? Live presentation, baby. Why don't you sit here and join us? We're learning about all the things in mast cells. Okay. All right, so speaking of conflicting access needs, mast cell activation syndrome, MCAS, great search term. Ehlers-Danlos syndrome, EDS, great search term. You're gonna find a lot of things with that alone. Mast cells are the key to the universe. You can find, medical literature on mast cells and most parts of all the things. If a healthcare provider were to look, they're generally not looking. Most healthcare providers have not heard of this. In my own training, I was taught that mast cell stuff was like a big deal. The person's having anaphylaxis. Like I was going to know if I saw this. It's that is one way that mast cell problems present. There's lots of other ways people present with all the things. So mast cell activation syndrome is a great search term to learn about management strategies, many of which are over-the-counter medicines and supplements. Given that long COVID is all the things kicked off by COVID, we have people talking about how there's no answers for long COVID and we need billions of dollars of research to find what to do for long COVID. You look up mast cell activation, there's like a lot of known things about that. And that's how we manage long COVID in this practice. Not entirely without prescription medicines, but we can really make a lot of impact for folks with over-the-counter medicines and supplements targeted at mast cell dysfunction. Last management pearl, so that I want to leave plenty of time for questions. Don't get COVID. And if you've had COVID, don't get it again. So there is research that came out this fall that the number of times you get COVID increases your risk of long COVID. Risk of long COVID for all comers is reported to be as high as 1 in 5. And it's known that autistic people have higher rates of long COVID than non-autistic adults. The mechanism of which has been reported to be melatonin deficiency. Melatonin deficiency is part of all the things. So anyway, we're already a group of people who are at higher risk of long COVID. We get COVID. Let's say that we are, lucky enough to not get long COVID. You get COVID again, may not be that lucky. So it's when you really think about long COVID as the fast track to dementia, long-term brain impact. And this is like a very, very, very big deal. And I make a very big deal about this because so many people don't have the privilege of being able to control the safety of the air they're breathing. And it's real. I'm supposed to give a content warning for COVID. I guess that's a controversial point. Anyway, don't get COVID and don't get COVID again. Okay. Last section, and then happy to take your questions. Talking with your healthcare provider about all the things is hard. I don't have to tell you, I'm sure I don't have to tell you that. I'm sure many of you have already experienced how hard it is. So I guess what I would say, first off, know that this is real. Like this thing you're experiencing, it's real and it's experienced by lots of other people. So it's real, it's a thing, it's very common in autistic people. And let's talk about, even before we like talk about maybe some scripts for how to talk with your healthcare provider and bridge the double empathy problem. Let's talk about what support's available outside the healthcare system. So I mentioned earlier social media really elevating the wisdom of lived experience. The global social media presence is potentially a really worthwhile source for ideas for over-the-counter medicine supplements and strategies for all the things. And even, local support groups, they can even identify specific providers who are like, let's say, Ehlers-Danlos informed or, neurodiversity affirming. So that's my first point about the outside the traditional healthcare system. But when you're seeking medical care, these are some strategies that some people find helpful. So from a co-regulation standpoint, meaning like, someone else's nervous system being with you to support your nervous system, bringing someone with you to a healthcare interaction, if that would be supportive to you, like do that. Because especially when so many people have had traumatic healthcare interactions in the past, you like walk into the healthcare facility and your limbic system's already reacting, just even being in the room. So like you don't have full access to your cortex to like be able to, think, plan, communicate in a way that you wanted to within this like 15-minute box that you're afforded. So speaking of which, I would say thinking about what you want to communicate ahead of time and maybe even writing down that script. Although some people might say, well, if I show up with my list, I get judged by the healthcare provider for being the person with the list, even though I have an access need for writing things down. So do many other healthcare providers. But there's like the really unhelpful, stigmatizing ways in which the medical system is such a profound mismatch for so many people's needs. So what that might be is being really clear about what you're looking for from a healthcare provider. So a lot of times, patient might share with me, I am looking for answers. Well, maybe flipping that a little bit, like you have answers, you have all the things. The healthcare provider is not going to be the one to provide you that, because in fact, just like a word about how healthcare providers are generally trained. We are generally trained that like you have some ideas of the possibilities of a diagnosis that someone might have. We call that a differential diagnosis. And then you do the tests. And if the test is positive, you make the diagnosis. Victoria and I were talking about this before we went live. That's not what happens in all the things. There is no test for all the things. There's no test for long COVID. Like it's so healthcare providers are already coming at this from in a paradigm that is not really what you need. What you really need is to feel better. So you're not like, I need some answers, tell me what's wrong, because then you're kind of set up for the provider to say, well, good news, your tests are normal. It's like, that's not good news. I still feel terrible. In fact, I feel worse because you're telling me that I should feel that this is good news. This is not good news. I feel terrible. Right. So anyway, so coming at this from, okay, well, I am looking for some strategies for X. I am wondering about this medicine, this supplement, like being more just having the lens be different. Might be less unsatisfying. So just reframing your goals. Personal example. So I'm a doctor who knows about all the things. I manage all the things for a living. My doctor doesn't know about all the things. And in fact, when I had a complication of my all the things several months ago, the medical advice I got was like, not consistent with all the things. So, all right, table that. So now here I am. I really want a particular medicine that I thought would be helpful for me to try. And so I approached that appointment by saying, I read about this medicine, which is like a totally benign medicine. I read about this medicine. I am interested if you know about this medicine. Let me seek your expertise, like a little bit of ego padding. But anyway, that was the approach, as opposed to like, I'm looking for answers. And so that's, it's hard. I'm not gonna, I mean, it's just really, really hard. Anyway, but I think, and we can strategize. I'd love if others have had successful strategies of discussing all the things with their provider. I think that'd be cool to crowdsource around. Also, what I'll also say is that, Victoria brought up before we went live, really the fact that we have this framework is really capitalizing on the strengths of autistic and ADHD brains. So here at All Brains Belong, we have a task force, and all the things task force, where we have interdisciplinary neurodivergent clinicians and community members, just elevating the perspective of lived experience. And it's really been the ultimate crowdsource. That's how we've learned so many things. And thanks to OAR and ARP, who are sponsoring some of the work of this task force, we have some funds that we can compensate autistic people with lived experience on all the things to share what's worked for you. And so if anybody's interested in that, reach out, please. So, and that's my contact information. So Ben or Sai, if you want to take away the slides, and then I'm happy to take questions.
Thank you very much for that. That's my brain just gone off now. Yeah, I think often more advantage should be taken of our monotropic brains, our monotropic focus, and also the ability to look at things from a different perspective. Because a lot of the time, I think when they involve the community, it's from a tokenistic sort of almost tick box exercise, and they forget that you've got people with all sorts of knowledge, all sorts of experience, and get rid of the power, the hierarchy, and just collaborate. And it's so obvious. Yeah, and that's what Sai says. It's a shame they don't use our expertise.
Right, and this is not. I mean, like what we're trying to do here. I mean, this is a co-created experience. I mean, this is an entirely autistic-led, autistic implemented. Like that's because it's, and everybody working on this project has skin in the game. We all have all the things. And it's amazing to me how many people, like even if you look at long COVID, how many people are going to these like tertiary care, quaternary care centers, like and oh, there's so much we don't know. There's so much we do know, because long COVID's not new. It's just all the things kicked off by COVID.
Yeah, and it's just that narrow thing. And as you said, it's this focus on getting this diagnosis, this one thing, and then it stops. And as it's shown that we have so many different co-occurring things going on, don't stop just there because you've got that one thing. That isn't the answer. It's like, show some curiosity. And I know a lot of that is limited by funds, but as you said, a lot of the things that you're talking about is from over-the-counter supplements and stuff like that, and to take a different approach and almost remove those barriers.
Exactly. And in this broken healthcare system, it's almost like, and I think I said this when I was here in October, it's like Google Maps. Like you're so zoomed in, you don't know what continent you're on. Like you really have to zoom out in order to really see the big picture. And I'm reading in the chat, Sai says, I consider myself to be quite informed on POTS, especially my own, and many of us experience the same things. Anecdotal evidence is still evidence-based. Absolutely, absolutely. There's a question in the chat about sleep apnea. I'm happy to talk more about that. So sleep apnea, and there's in most instances we're talking about obstructive sleep apnea. For any of us, when we go to sleep at night, the muscles in the back of the throat get floppy or relaxed. But for many people, whether they have like floppier connective tissue or or a narrower airway, when that relaxation happens, it temporarily like closes off the airway, brain wakes up, thank goodness, and back to sleep. Some people don't even know that this is happening. They don't know they're waking up. Some people have obvious symptoms like they're snoring, or, you know, if they have a bed partner, the bed partner observes that they they stop breathing. But a third of people don't have obvious symptoms. So it might be headaches when you wake up, morning headaches. That would catch my attention. Teeth grinding. A lot of times people are like, oh yeah, I grind my teeth, that's because I'm stressed. Yeah, you might be stressed, but you might be teeth grinding because you're in fact trying to keep your airway open. So, and that's something that actually does have a good test for it. So, and that's something that actually might be pretty successful to talk about with your healthcare provider. Hey, I'm wondering if I have sleep apnea. Can we talk about that? And that might be a fairly focused and worthwhile pursuit.
Yeah, I mean, what I struggled with is particularly when I think, because we do have such a different sensory processing system, when you don't actually know what is going on and you don't have the language to describe it, particularly if you've got the interception sort of, you're not sure what internally is actually going on and you're so disconnected from yourself, and how you present isn't the same as
Absolutely.
what we expect, and it's how to deal with that.
Right. And so one of the other things that we're working on here is developing a tool that people can use, and it'll just be freely available when it's done, to be able to use to communicate what you're experiencing in different ways than the standard, what's called review of systems, like the check boxes that you get when you show up to a healthcare provider. Like, those words don't mean anything to many people. They certainly don't mean anything to me. And so, you know,
it's just like, what? It's just,
what is that? I don't know. But yeah, it might be like, you know, it's not pain, it's like buzzing. It's, you know, it's just a range of terms. Or maybe it's you know, maybe we need some graphics, just like multimodal ways of communicating. Because, you know, you brought up interoception differences. There's also, when you're hypermobile, you are going to be less sensitive to proprioception. You're not going to feel things because you're like, your ligaments, they stretch, and you don't feel it until till something's big. And so, since proprioception and interoception they go hand in hand, you gave the example, Victoria, of like you didn't feel pain until, you know, big pain, right? So this is so common. And because many people have had the experiences of just being invalidated in terms of what you do feel. Like, I remember as a kid being like, it's loud, it's bright, it's this. No, it's not. Like, oh, I guess I'm a person who doesn't know when it's loud. So you have that brain body disconnect that's just, you know, it's for so many people, it's a lot of unlearning and working really hard to bring back that brain body connection. In the chat, comment about paradoxical reactions to medication. A lot of times, I mean, that's a common phenomenon for neurodivergent people and otherwise. One of the things I am curious about, and when a patient of mine brings up as a paradoxical, having the opposite response to what we're expecting to a medicine, a lot of times I think about mast cell activation syndrome. I think about is someone having a mast cell response to that medicine? And is it the medicine? Is it the fillers or the dyes in the medicine? Is it that we're actually on the right track? I again, not giving medical advice, I'll just tell a story of my own medical life. I remember when I was having really more significant mast cell symptoms, and I started taking an over-the-counter antihistamine. I had a paradoxical response to it, and I was like, "Oh, this is that thing that people talk about." And then 4 days in, everything got better. It was like, so we were actually blocking the histamine that the mast cells were producing, and it felt terrible at first. So it's anyway. So my general response to the question about what about paradoxical reactions is I would think about mast cell activation.
Could you explain a bit more about mast cell activation?
Absolutely, yeah. So totally. So mast cells are a subtype of immune cell. You have mast cells on the surface of every organ system. And so mast cells they're required to keep you safe. So if there's an invader, in the air, and my mast cells in my nose airway system, release chemical signals to recruit more immune cells to help. And those chemical signals might be histamine, leukotrienes, norepinephrine, heparin. There's all kinds of chemicals that the mast cells release. And so when there's mast cell dysfunction, it is either that the mast cells are responding to something that's not really an invader, like it's not a threat, but it's responding anyway, or it is a threat, but the mast cells are responding in a totally dysregulated way. It's a disproportionate amount of histamine that's reacted. Like, yeah, maybe I'm at a campfire and the, whatever impurities in the smoke, my mast cells have decided that this is a threat, but like, maybe I don't have to have a heart rate of 150 for 4 days. Thanks, mast cell dysfunction. So it's and since there's mast cells on every organ system, people get a range of symptoms. And so whether it is, the mast cells in the gut responding to something you've eaten that's a threat, or mast cells on the skin, you have hives because of something in the environment, or, mast cells in the breathing system responding to something in the air you're breathing. And so that is why many people believe that, like, targeting mast cells is a really important part of the management of all the things.
And how sort of knowledgeable if you're going to be coming in contact with sort of general physicians and stuff, how knowledgeable and known is this?
Yeah, really hard. I think that it really does depend, but on where you are and the particular providers. But there are lots of gems of knowledge from medical providers doing this work and specializing on some parts of all the things, and many people don't have access to that expertise.
Because I've often found that it's how you approach this, and sometimes when there is this double empathy problem that you go in, it's almost seen as a direct threat that you have these knowledge, and it's interpreted that you don't trust their expertise, which sometimes
I don't trust their expertise.
Right? And I think naturally we're just seeking to understand, and it's sort of a natural way of trying to find the pattern to understand. But you take this information and it's seen as you are discounted, and then you get this reputation, and trying to access healthcare becomes a problem. And Size said, going on from reactions to medication, serotonin, antidepressants, beta blockers, exacerbating ADHD, and taking supplements, L-tyrosine, 5-HTP, etc. How do we keep safe? How do we make sure that sometimes are very literal, that were not taken in by people who are not who are not legitimate.
Right. So I would say that one is to be, you depending on where you are, you really want to have a high quality supplement. In the United States, supplements are not regulated the same way that prescription medicines are. So you don't necessarily know that what's like in your bottle is actually what is said to be in your bottle in the United States. I don't know how it is in the UK, but there are some like quality ratings, and in the United States, like Consumer Reports has a supplement guide that can be really useful. And I don't know if there are like rating systems that other countries use to as quality indicator. Sorry, when I said Consumer Reports, I meant Consumer Labs. Nothing's just like come out automatic speech. Consumer Labs. Anyway, so I would, even if your healthcare provider does not know about all the things, they should be able to help you answer a targeted question like, I am considering taking this supplement. Can you help me figure out if it might interact with my current medications and other supplements? Clinical pharmacists are also another, another really important source about this. So like I would be looking for interactions. I would also be looking for, like, as a doctor, what I'm looking for, if someone, because patients all the time will approach me and say, I want to, I read that this thing might be helpful for my all the things. And I was like, I'm here as a guide. You can, it's your life, it's your health. If you send me what you've read, I can just tell you, I don't know about that. Like, I think that in general, we should be looking for professionals of all kinds. Just be like, I don't know about that, but I'm happy to learn with you. Send me the thing. I'll read it with you. I'll tell you what I think. If I still don't know, I'll see if we can find someone else who might know more about this. But I'd be looking for, interactions from a safety perspective, and, what are the potential side effects? And if something is benign, like, meaning I'm not worried, like somebody actually, so for example, one of my patients asked me about ginkgo biloba, and I was like, all right, well, I can tell you that I'm not familiar with research that this supplement will help this particular thing that you're looking for it to help with. And what I know about this supplement is that these are the side effects that this could be associated with. And I know that it's processed by the liver. And so I happen to know that you're on other medicines and supplements that are processed by the liver. So I'm a little worried about that. Do I know if definitively? No, but I'm just giving you some information about risk. Sorry for the monologue. Should we take
No, I like monologue. You don't have to apologize for monologuing. It's
I'm amongst neurokin.
That's how we communicate. And I think that's what I like. That's when it is that sort of admittance, I don't know, but we can find out. And it's just like, I feel safer if a physician actually says that. Because I'd rather be given that than a false truth and just expected to accept something. And that is what I find really difficult. Sai says there's still the communication and trust barrier with doctors, hence why more and more are going private or being caught out by unregulated suppliers. And it's so true. And particularly if, as monologue, we need more time. We need that additional processing time. And you don't have that in a consultation typically.
Yeah. Or there may be many models where, like, for example, like the only reason I'm really able to do the work I'm doing is that I quit my job and like started a different model to really break out of the restrictive way of practicing medicine. And a lot of other people who do that, there's this like trade-off, right? So if you break out, we take health insurance. I mean, so in the United States, we don't have universal health care, and where I am, there are health insurance companies. There's good access to have health insurance, but then the health insurance, just because you have it doesn't mean that it actually pays for your health care here. So like you pay these premiums and you're enrolled, but it doesn't cover things. Anyway, so a lot of practitioners around here just like don't take health insurance. Well, then that's not accessible to all people. So from an equity standpoint of like who gets to show up, it's really important to me that everyone gets to show up here. So we take health insurance. So it's just it's this balance of that's all. I don't think I have like the end of that sentence. It's important to me to take health insurance. That's all.
Yeah, I think here, yes, there is that less and less almost. It's all down to budget restrictions and things like that. So there isn't the availability or the choice. And sometimes if you go into a doctor's or a GP, you can only discuss one thing per consultation, and you could have waited months for that.
Right.
And if you're talking about all the things, then, and it's like, which is the most
right?
What you do,
right? And especially because you can't abstract out like what's my POTS versus what's my mast cell. It's one thing. And so and I think one of the barriers to people feeling better is that when each part of all the things is treated separately, you're not accounting for that internal conflicting access needs, and you're pretty stuck. In the interest of time, should we go through some of Ben says that there's some comments in the chat.
Ben, could you put them up? Yeah. So Ricky says, how much of AATT or lower life expectancy can be attributed to minority stress? Example, work discrimination may mean we can't afford a safe place to live or eat well, or we can't access a doctor by phone.
Yeah. So the barriers to healthcare access. So I guess today we've talked about like once you even get an appointment, like you may not get what you're needing, but Ricky's bringing up like we can't even get there because of all of the systems barriers. You must fill out the 20-page packet to become a new patient. You must pick up the phone to get an appointment. Like that's why I don't get healthcare, because I can't do those things. So I think that when we think about all the things as an immune nervous system response, minority stress is going to greatly contribute that. So your immune system, your autonomic nervous system is going to be is going to flare in response to all the things in your environment. So absolutely.
I think it's like logical. If you're living permanently stressed because you're taking everything in, and you've got to wonder how much trauma plays into this and impacts the immune system.
Absolutely.
And as sort of a marginalized group of people, are experiencing trauma on many levels to what people don't realize, particularly the sensory and things like that. And that repeated sort of trauma and leads to the hypervigilance, and your system can only take that for so long.
That's right.
So it's got to interplay into this as well.
Absolutely. And so, especially, when we think about, all of the intersectional ways in which people are marginalized, I mean, just like stacking the threats. And I said that there's literature on mast cells and each part of all the things. There's literature on mast cells and PTSD. This is a thing. So yeah, I could not agree more.
And then it's also, when I think about it, it's burnout and things like that. So Samantha says, isn't this what naturopath doctors do, look at things holistically?
Yeah, and I think that I would think about like the holistic view as being on the level of the provider as opposed to the type of provider, because you could have an allopathic physician who is looking at the whole patient, an osteopathic physician who's looking at the whole patient, a naturopathic provider who's looking at the whole patient. So it's really, you're looking for holistic care regardless of what specialty you're pursuing. And there may be, people who, like providers who individually endorse that looking at the whole person is how they see the world, but it's the system that gets in the way of them doing the thing. Like when you have a 10-15 minute visit in primary care, like Victoria was saying, that that your employer sets this insurance billing rule that you can only talk about one problem at a time, like that is a systemic barrier to a provider of any type seeing the whole person.
Absolutely agree. And Sai says, I've got more results and knowledge gained in the last 4 years through the community than in 40 years from the system. Not the system's fault, but those that built and maintain it. And
Yeah.
you've got to think how much now it's sort of like the capitalist thing and all the pharmaceuticals. How much is this impacting on this holistic view? Because they're not going to make a lot of money off
right
these
and look
supplements and over-the-counter things.
Right, and especially when we really even think about nutritional changes that contribute to all the things improvements, like that's there's nobody's making money on that.
No, it just seems that's what it's given for. Kat says, to be a part of the task force, how do we get in touch?
I'm gonna give you I'll put a couple things in there, but what we'll do is this is my email address. I'll also give you, so Lizzie is our education programs coordinator at All Brains Belong. Lizzie has way better executive functioning than I do. So that's Lizzie's address too. So you can write to either of us.
And is that just for people based in the US or
No, come on, come in. It's open to everybody.
Oh, that's actually, that sounds really interesting.
Cool.
Sai Northern Naughty says, how do we know who to trust when professionals gaslight and others might be scams?
Yeah, I mean, I think that if someone gaslights you, if someone gaslights me, they go in my unsafe bucket. Like they're just in my unsafe bucket and I don't trust them. So I think if you get that vibe, that I would listen to it. I would listen to that vibe. So I also think that when you surround yourself, this is why I started, when we started talking about like how to talk to your healthcare provider, one of the first things, I hope I said this, was that like, this is real. This is a thing. You have all the things. It's a thing. That knowing that I'm hoping reduces the likelihood that when someone attempts to gaslight you, even inadvertently, that they're not successful, because you already know what your thing, you already know this is a thing.
Yeah, I mean, the issues come when the gaslighters are your gatekeepers as well.
Oh yeah. Oh, there's so much gatekeeping that goes on in the healthcare system, for sure. When we think about, there's so many pieces of that. Sounds like another Aucademy, but yeah, it's healthcare.
Yeah, we did talk about I think it was mentioned at the end of the last live about pandas, but that's sort of, yes, very big. And I think that is another sort of series and probably worth having people who've who've actually experienced it rather than
right. I agree. Yeah, I and even like clinical expertise, I wouldn't. I think you could find someone with more expertise. Yeah.
Brilliant. So unless there is any more questions or you have anything else you'd like to talk about, we will sort of finish with our usual questions. So what is your current favorite new stim?
I've been smelling coffee beans lately.
Yes.
Yeah, it's my new thing from like in the past couple days. It's been very regulating.
I think at the moment, it's like loose leaf tea. That is my new thing. I just quite like that ritual in the morning of having that and having it in like a smooth mug, and that is sort of my start to the day.
It's wonderful.
Sai, do you have any? Sai says, learning about the brain is my new thing.
It's awesome.
I can go along with that. And the old age bit. What is your favorite form of potato?
A potato that someone else cooked, because I have insufficient spoons to prepare a potato these days.
I think that would be nice. Someone else to cook and not to have to think about what choice of potato you want to have. Just surprise me.
Because my husband has COVID, I'm like I would, I eat cereal for a lot of my meals. But I'm like, I have a 5-year-old, a newly minted 6-year-old I'm supposed to feed now. And so I actually chopped sweet potatoes like hours ago. I didn't cook them because that's like another step of executive functioning, but like I chopped them. I'm really proud of myself.
Yeah, I'm pretty impressed actually. It's even peeling the potato. It's like,
I didn't peel one. I just chopped.
No. Extra rubbish, extra fiber. We'll just leave it as it is. It's good for you that way. So I don't know what next. And my question. My daughter has a love of seals, and everyone gets asked this question: what is your opinion of seals? It will make her very happy.
I think they're cute. That's my opinion on seals.
That's hers as well, to be honest. Everyone thinks she's going to info dump massively on the information. No, she likes to, she likes to watch them all the sort of TikTok things and all the reels, and it sort of regulates her and calms her down.
Is there like a big TikTok market on seals? Like, there's a big presence on this? Cool. That's the thing. Like, there's
everyone.
It's the idea of you find the people who love what you love, and that's we all need that.
It's connection, isn't it? At the end of the day.
Amen.
So next week on Aucademy, Callum and Jenny discuss their new magazine, Autistic Revolution. So I hope you can join us for that. And now we're going to finish with some awkward waving and the outro. Wow.